Assalamualaikum warahmatullahi wabarakatuh. In this video, we are going to explain about sensory evoked potential tests. Our group consists of 3 members, which is me, Muhammad Alif bin Muhammad Nazri, Muhammad Loman bin Azani, and Nur Amalina binti Suhaimi. Kami akan menggunakan 2 bahasa ketika menerangkan setiap point. So, let's get started. Overall, there is introduction, and then disease or symptom and risk of the test, electrode attachment, procedure of the test, result of the test, and lastly will be the conclusion. Sensory evoked potential studies measures electrical activity in the brain and the time it takes for nerves to respond to stimulation. The size of the response is also measured. Nerves from different areas of the body may be tested. Kebiasaannya, sensory evoked potential mempunyai 3 jenis test. The first one is visual evoked response test, VER. This response occurs when the eyes are stimulated by looking at a test pattern. Second, Brainstem auditory response test, BAER. This occurs when hearing is stimulated by listening to a test tone. And the third one is Somatosensory evoked response test, SSER. This occurs when the nerves of the arms and legs are stimulated by an electrical pulse. How the stimuli delivered? Untuk visual evoked response, stimuli akan dihantar melalui strobe light atau melalui skrin yang mempunyai checkerboard pattern. Brainstem auditory response pula, clicking noises atau tone dihantar melalui earphone. Manakala somatosensory evoked response, electrical pulse akan dirangsang pada bahagian pergelangan tangan atau lutut. Pulse ini kecil dan tidak berbahaya. Disease or symptom and risk of the test. The risk of sensory evoked potentials. The test may cause a little discomfort. There may be risks depending on our specific medical condition. Be sure to discuss any concern with our healthcare provider before the procedure. Sebagai contoh, ibu yang sedang mengandung, pesakit yang menghidap sakit jantung atau epilepsi. Disease diagnosed with sensory evoked potential. First is multiple sclerosis. Multiple sclerosis is a condition that can affect the brain and spinal cord, causing a wide range of potential symptoms. It happens when a faulty in the immune system results in damage to the fatty layer of myelin that protects nerve cells. This damages the electrical signal speed that travels in nerve cells. A person with multiple sclerosis may have symptoms such as fatigue, vision problems such as blurred vision, muscle stiffness and spasm, problem with body balance and coordination. Optic neuritis is a condition that causes inflammation of the optic nerve. It may be associated with demyelinating disease. The exact cause is unknown. It is believed to develop when the immune system mistakenly targets the substances covering the optic nerve. Symptoms such as pain or dull ache behind the eye, vision loss in one eye, loss of color vision, and flashing lights. Tumor, an abnormal mass of tissue that forms when cells grow and divide more than they should or do not die when they should. Tumors may be benign, which is not cancer, or malignant, that is cancer. Tumor begin when normal cells develop mutation in their DNA. A cell's DNA contains the instructions that tell a cell what to do. The mutation make the cells to grow and divide rapidly and to continue living when healthy cells will die. Person with tumor may have symptoms such as change in pattern of headaches, vision problems such as blurred vision or double vision, difficulty with balance, personality of behavior changes, and seizures.
My name is Nur Amalina binti Suhaimi. I will explain about electrode attachment to patient. Visual evoked response (VER) placement dia adalah di tengah dahi di bahagian depan, di atas kepala, di belakang kepala. Brainstem auditory response BAER pula Placementnya adalah di tengah dahi, di atas kepala, di belakang dua belah telinga dan di telinga menggunakan headphone. Somatosensory Evoked Response SSER pula placementnya di kedudukan kulit kepala di bahagian depan, di bahagian bahu, di belakang leher, iaitu bahagian atas sedikit, dan di belakang lutut. Procedure of the test untuk Visual Evoked Response VER. Pertama, patient akan diarah untuk duduk jarak beberapa kaki dari skrin dan relax. Kedua, akan diminta untuk fokus pada bahagian tengah skrin. Ketiga, tutup satu mata pada satu masa sementara skrin memaparkan chatbot dengan warna terbalik sekali atau 2 kali sesaat. Keempat, tes ini akan direkod bagaimana mata bertindak balas terhadap perubahan corak. Seterusnya, Brainstem Auditory Response BAER. Prosedurnya adalah: pertama, duduk di dalam bilik kalis bunyi dengan memakai headphone. Kedua, bunyi klik akan dihantar melalui phone telinga ke telinga yang sedang diuji, sementara bunyi penyamaran akan dihantar ke telinga lain untuk melindungi dari rangsangan. Ketiga, masa diperlukan untuk berbalas terhadap isyarat yang dapat menunjukkan sama ada terdapat kerosakan pada saluran pendengaran dalam otak atau saraf akustik yang menghubungkan telinga ke otak. Seterusnya, prosedur Somatosensory Evoked Response SSER. Pertama, duduk dalam keadaan yang selesa. Kedua, elektrod akan dipasangkan di kawasan kulit kepala dan di kawasan badan seperti pergelangan tangan, belakang lutut, belakang badan bahagian bawah. Ketiga, elektrod shock akan kecil dan tidak menyakitkan akan dihantar melalui elektrod yang diletakkan di badan. Keempat, setiap ujian aktiviti elektrod yang dikesan oleh elektron pada kulit kepala akan dimasukkan ke dalam recorder. Recorder menguatkan isyarat supaya doktor dapat menafsirkan result.
Result of the test.
In the recent decade, the clinical usefulness of SEP entered the operating room, allowing the intraoperative monitoring of central nervous system and safeguarding CNS structure during high-risk surgery. Continuous SEP monitoring can also warn a surgeon and prompt intervention before impairment becomes permanent. Testing the median nerve SEP is used to identify the sensory and motor cortex during craniotomies and in monitoring surgery at the mid-cervical or upper cervical level. Some of the clinical role of SEP are to establish objective evidence of abnormalities when sign or symptom are equivocal, to look for clinically silent lesion, to define an anatomical level of impairment along a pathway, to provide evidence about the general category of the pathology, and to monitor objective changes in patients' status over time.
Standard waveform. This 2 diagram shows the VEP waves. The VEP nomenclature is determined by using capital letters, stating whether the peak is positive or negative, followed by a number which indicates the average peak latency for that particular wave. For example, P100 is a wave with a positive peak at approximately 100 milliseconds following stimulus onset. The average amplitude for VEP waves usually falls between 5 and 20 microvolts.
On clinical grounds, somatosensory evoked potential are currently used to discriminate between hysterical and neurological conditions. The present methods can identify patients with severe gait disturbance who had the near total absence of SEP response on the scalp during the symptomatic period, which normalized after recovery. This finding, along with other, may shed light on the brain correlate of conversion phenomena.
These are the most references that we use to study and learn about the sensory evoked potentials. I think that's all from the 3 of us. Thank you for watching this video.